Across the NHS, patient waiting lists are longer than ever. Behind every number is someone waiting for care, and a team trying to deliver it. But when data lives in different systems, it's hard to see the full picture. Who's waiting? For how long? And what should come next? By securely bringing that data together in Snowflake and validating every entry, trusts can finally see what's real and what needs action. That clarity means faster access to diagnosis and treatment for patients who need it most. It also means less time spent untangling spreadsheets and more time focused on care. With a single, trusted view of the waiting list, staff can plan resources better and make confident decisions. And there's another benefit. Each validated patient removed from the waiting list can generate £33 in additional funding, helping trusts reinvest directly into frontline services and move closer to the 92% RTT target. Because when data is accurate, care becomes more efficient, and everyone from patients to providers benefits, bringing people and data together. That's how healthcare moves forward.